Aphorism number 3. If the physician clearly pursues what is to be cured in diseases, that is to say, in every individual case of disease, knowledge of disease indication. If he clearly pursues what is curative in medicine, that is to say, in each individual medicine, knowledge of medicinal powers, and if he knows how to adapt according to clearly defined principles what is curative in medicines to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue, to adapt it as well in respect to the suitability of the medicine most appropriate accordingly to its mode of action to the case before him, choice of the remedy, the medicine indicated, as also in respect to the exact mode of preparation and quantity of it required, proper dose, and the proper period for repeating the dose. If finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat judiciously and rationally, and he is a true practitioner of the healing art. Now, the explanation. In this aphorism number 3, Dr. Hahnemann has told about knowledge of physician. Physician should have knowledge of disease and what is to be cured in the disease. In each and every individual case, physician should know about what is to be cured, that is indication of disease. And if he is able to pursue that what is curative in medicine, curative power of each and every medicine called as knowledge of medicinal power. If physician knows how to apply this knowledge of disease and knowledge of medicine according to clearly defined our basic fundamental principles, means if he knows what is curative in medicine should be applied according to the fundamental principles to what is morbid in the patient, so recovery of the patient must be sure. Physician should have knowledge of medicine so he can select remedy appropriately for the case before him according to mode of action of medicine, proper method of preparation of medicine, and exact quantity required for the case, and should repeat the dose of medicine at proper interval of time. So here Dr. Hahnemann says that physicians should have knowledge of disease, knowledge of medicine, knowledge of mode of action of medicine, preparing the medicines, knowledge of dosage of medicine, knowledge of obstacles to recovery for each case, so that physician can restore the sick person to healthy state permanently. Then and then only physicians understand that how to treat the patient judiciously and rationally. Then only he can become the true practitioner of healing art. Judicious means with proper judgment, and rationally means reasonable or logical means. Knowledge of disease. What is to be curative in disease? For example, if there is a case in which patient complain of weakness, investigation suggests anemia. Weakness is very common symptom of anemia. But if patient says, I feel more weakness after eating, then it is the symptom to be treated in diseased person. Here, physician has to utilize his knowledge of medicine and find out the remedy which has curative power to treat this weakness after eating. To apply the law of similia, fundamental law of cure, physician should find the remedy having similar symptom in its proving, so that is called what is curative in medicine. Knowledge of disease helps us to differentiate between common and peculiar. Knowledge of curative in medicine, knowledge of materia medica, knowledge of pharmacy, on mode of preparation, selection of dose and repetition, posology, followed by the obstacles to cure. For example, advise a smoker to quit smoking to reduce the adverse effect of bronchial asthma, etc. So this is aphorism number 3. Thank you.